Hello, and welcome to The Mind of a Therapist, a podcast where we interview psychotherapists and helping professionals what they are passionate about in order to provide you with messages of encouragement and hope. The Mind of a Therapist is sponsored by Psychological Counseling Services, PCS, Healing Hearts and Transforming Lives. Please look into our intensive program at pcsintensive.com. I am Dr. Marcus Earle, the Clinical Director of PCS. Each episode will be hosted by me or another PCS therapist. Please enjoy the following discussion.
Hello, I'm Dr. Erin Buggy.
And I'm Alethea Wood.
And we are here today to have a conversation that bridges the gap between mental health and perinatal wellness.
Yeah, so today we're talking with Dr. Michelle Davis. She is a certified nursing midwife, a neonatal nurse practitioner, and she also has her doctorate of nurse practitioner as well. And she is a midwife and the wearer of many hats, I hear, at Premier OBGYN. So why don't you tell us a little bit about yourself and about your practice?
Great. Thank you so much for that introduction. My name is Michelle Davis. I originally was a labor and delivery nurse, and I was just telling my friends over here that I almost failed nursing school because of psych. And here I am, dealing day to day with mental health issues with our moms and just patients that we see on a daily basis. But my background had been labor and delivery nurse for about 20 years. I've always been at Banner University. And then I went into becoming a neonatal nurse practitioner just because I think at that time I was in a mindset where I wanted to help moms out in that way and in the capacity of helping them get through having a baby that's in the NICU, whether they're a 20-week or 24-weeker to all the way to, the ones that were born with any type of special needs. Then finding out that, actually, here's a story. The very first baby that I have ever resuscitated was in the ER, and that was as a neonatal nurse practitioner student. Wow. This patient had transferred to a home birth because she was afraid to go to the hospital. Not realizing, she said she has done a lot of her research, but at that time the baby had flipped to breech. So they tried to push and push at the birthing or at the home, and baby got stuck. The baby did come out, but in the meantime, baby wasn't breathing. It got, EMS took a little bit of time for them to get to the home, bring the baby to the ER. That was the very first time I've ever heard about midwifery. Well, not really the first time, but at that moment in time, I said, oh my gosh, what can I do better to help these women, to bridge that gap where they're not afraid to come to the hospital to have a delivery. So why is this happening? So I started talking to some of my colleagues at the hospital, and one of them was a physician at a clinic. And she had said, Michelle, why don't you just go back to school and become a midwife? And that's what I did. And here I am.
Years later.
Many years later.
Yeah.
Yes. So, and I think I always fall back to that story because truly that's what made me realize that I am much needed more out working with moms rather than the neonates, where neonates can't speak, but I could certainly help promote that bridge between moms who want to deliver at home versus at the hospital. And that's why I'm at Premier also.
Okay.
Wow.
And you had said that you had recognized that there were some unmet needs through that experience. What needs can a midwife meet in that role?
Yes. So I don't want to talk bad about obstetricians or medical doctors because they're certainly not like that. I think as a midwife, a lot of us hold that we have, many of us who works at the hospital, we have a nursing background. And not just that, but what midwifery is basically the definition is to be with women, right? And that's what our passion is. We hold their space, we protect them, And it takes a lot to do that too. When moms are they're vulnerable at that moment, they need somebody where somebody could just hold their hand and say, this is going to be okay. And you're in a safe space. Many obstetricians don't do that. They will, a lot of them will mainly just go in, make sure their medical needs are being met, but their emotional component is not being met. And when we say, they didn't have trauma, well, we're not talking about just physical trauma. We're also talking about mental trauma that we don't know. And there's a lot of it in the background that we don't know what's happening with them. And I think a lot of midwives, were pretty good at making sure that we could get that out of them.
Mm-hmm. So getting to know them in a more kind of comprehensive way and bringing in that being with peace in a big way.
Yeah.
Yeah.
Yeah, especially in such a vulnerable time where, you are, it's a raw time, right?
Yes.
Being a mom that's giving birth, and to have someone who can really support you and, like you said, hold your hand through that. I mean, that's really significant and really powerful. I think what we talked about a few days ago was just how to take, a traumatic birth, to just being a difficult one. The difference in between is that sense of having people around us and having support. And it sounds like as a midwife, you're able to stand in that gap and hopefully not have a difficult experience. But if that is what's going to happen, to show up with a lot of support and care.
Yeah. And that's what we try to do, at least for me, or at least my team and I. That's, we pretty much hold the same philosophy. Yeah. And we pretty much give that to all of our patients, where regardless whether you're on the on-call schedule and, you don't know that person, but, we take the time to go in the room and say, this is your show. You tell me what you want. I'm going to educate you. This is what the recommendations are, but ultimately this is your body. I need you to know that you're safe and I have your back.
Mm-hmm. Yeah.
So I'm hearing empowerment and working collaboratively. Those are part of the philosophy of midwifery.
It is.
Okay. Are there additional aspects to the philosophy? Really what kind of guides what you do and don't do?
For me, I play it by ear. It's not textbook. It's not always black and white.
Yeah.
And I feel like a lot of times people are guided by, this is what needs to be done, and they're checking off some boxes, but everyone's so different. Each pregnancy is different. So I look at the person, see what's happening at the moment, and then I'm guided by what's happening at the moment.
Yeah. It sounds attuned. You're attuning to the moment and the complexities of it and the needs that are present,
right? And just
responding
when they tell me, oh my gosh, Michelle, the baby's sunny side up again. What am I going to do? And I'm like, listen, we're not at that pushing stage yet. We're going to play it by ear and see what your body does. Let's see if don't set your mind on just pushing on your hands and knees, because what if you can't push on your hands and knees? But that's ultimately what what the TikTok or Google's telling them is, make sure you're pushing on your hands and knees. But what if you can't? And the only way we could get this baby out is on your back or on the side.
Yeah. So you hold the nuance and the complexities.
Right. So I'm like, let's just play it by ear. You're in charge until your baby fires you.
And they do that.
Sometime in the teenage years.
Yeah,
exactly.
I was going to say, I think it happens throughout, not just in the birth, but at
fire you
points.
And rehire you.
So,
Yeah. So what do you notice changes for moms when they're empowered mentally and emotionally through this process?
Oh, they get a lot stronger. They get stronger to get through what they need to get through. And sometimes also they want to get that. It's almost like they want to make sure that their midwife or whoever's with them gives them that okay. To say it's okay to cry. It's okay to get your epidural. But if you don't want it, it's also okay. But by giving them those choices, it gives them a sense of being heard, which, sometimes they're not heard. They feel like the hospital doesn't hear them because they come in and you need to be on the monitor, you need your IV, you need this. But the fact that we're saying it's okay not to get it right now, but just know that if there's an emergency, please be okay that you need an IV access.
Yeah. I think I'm also hearing some non-judgment. If
Yes.
you want the epidural, you can get it. If you don't want it, you don't have to get it.
I think a lot of moms want that okay,
Yeah.
not you're being forced to do this.
Yeah. What you're describing is really similar to what it's like for clients when they come for therapy. There's this idea of these kind of core tenets of that are required for good therapy to occur. And part of that is an attuned empathic connection. There's also this aspect of non-judgment, that it's safe to kind of express yourself authentically, be as you are, choose as you do, and then feeling seen and known and understood.
Yes.
Those are key ingredients if there's any good therapy that's going to happen.
Yeah. And also, they want to be, you want them to come in, or I think people who doesn't want mental health, or no, we're talking about that. They want to have it. If they don't want it and we're forcing them, they're not going to open up.
Yeah.
So I think by them, opening up, it just gives them a little bit more power. And then I think the outcome would just be better.
Now, in terms of mental health dynamics, you see clients who are pregnant, you see their partners coming in with them, you see them through the labor process, and then you see them postpartum, right?
Yes.
And so are there maybe some common themes or some common symptoms that you tend to notice in clients where you either encourage them to go have therapy, or you just wish clients we're going for therapy when these certain things come up?
So signs, lots of crying. Most of my patients has my number. So when I start seeing the repetitiveness of, I don't feel good, I have them come in, or I reach out. I'll call them on the weekend. What's going on?
Okay.
And there's like always that, it's almost like I can't breathe, or I'm having a panic attack, or just those triggering texts. I'll have them come in. And a lot of them don't want to be on medication. And I would tell them, listen, how can you be a better mom? Because that's what you ultimately want to do. You've done all this work for 9 months, have this baby, for you not to have, mental health. I at least need you to talk to a therapist, because I'm not a therapist. And then I would tell them, about me not passing nursing school almost. I'll be here to support you, but I need you to talk to someone who could better help you with your, what's happening.
Yeah. So lots of crying, high anxiety, overwhelm, those kinds of things. Anything else that you tend to see that might impact, say, how a birth goes or how postpartum is experienced?
Well, when their birth plans don't go the way they want it to, those are the women I especially have a little bit more, do a lot of following up with them. Just, there's certain ones where, because I see them on a weekly basis towards the end. But more so throughout the whole entire pregnancy, there's a lot of patterns of, I need to do XYZ. Now I need to do this. And then at the end, they don't get their birth wishes. That's where I'm like, okay, this person needs to be seen at least on a weekly basis, or at least have some kind of follow up, because their mental health is going to go down.
Yeah. What do you tend to notice in terms of maybe how they are post-birth when the birth plan doesn't go as hoped?
It goes. Some people are, crying when I see them the next day. And then they're constantly, what if I did this? What if I
Yeah.
did that? And that's when I pull up the chair and we reminisce their birth the day before. I always make it a point to see them the next day, at least, just to go over what had happened if it didn't go their way. But even the ones that had a really nice, amazing delivery, they also have a little bit more. I think those people are a little bit more work than the ones that I would think that would have more issues.
Mm-hmm.
I don't know why.
Yeah. More to ponder there.
Yeah.
What I was hearing with regard to those whose birth doesn't go as planned, when you meet with them after and you notice their mind kind of looping on, what if I had, or if only I had, what I hear is grieving.
Okay.
I hear the
Yes.
bargaining dimension of grief, which often sounds like, if only I had, if only I could have, what if? It's the mind's trying to wrestle with a different outcome
Yes.
than the outcome that was had.
Yeah.
Yeah.
And I think as moms, we tend to be really hard on ourselves just anyway. And as you're taking this first step right into motherhood and parenting, it can be just this overwhelming feeling of like, gosh, right out the gate, I have failed. I've let my baby down. My body let me down. And
Yes.
that can be a lot to just
I hear that a lot.
process.
I hear that I failed my baby. I failed myself. And I'm like, what did you fail? Because we have a baby in your arms. This baby is not in the NICU. This baby is not in the nursery. This baby's in the room in your arms right now, and you're breastfeeding. So what did you fail? I think a lot of those too, some of those moms are like, but I didn't do it without an epidural. And I'm like, okay. So it just gets a little bit,
Some of the standards and
gets draining.
expectations
Yes,
that you have to.
because a lot of it, I blame it on social media.
Yeah. Well, I think
Yeah.
that's something to really talk about, though, because I think that there is kind of this culture, societal expectations of how birth should be. And it kind of depends, right, on maybe how your mom gave birth or your friends are giving birth. And so there can be a ton of pressure on what just your birth looks like. And as you've been talking about, well, everybody's body is so different. We don't quite know what's going to happen until it happens.
Correct.
And so everyone's having a different birth, but there's still this underlying idea of this is how you should give birth, right? Go to the hospital, get an epidural, push out your baby, or go to the hospital and you just magically push out your baby and there's, little to no pain. It's totally fine and you're just doing great. And that's not realistic,
No.
At some point, you're butt naked screaming.
Exactly.
Usually.
Agreed. No, that's happened a lot of times. But I think social media has a lot to do with how people should react and act. And even ChatGPT is what now I'm learning too. I had a mom that said, because she was doing something with her jaw. And I said, what are you doing? She said, ChatGPT told me to do this because it's connected to my cervix. And I was like, oh, okay.
So 20 years ago, you probably started facing more of the internet challenges, and Google told me this, and now it's social media, and now the next version is ChatGPT. So yeah.
So, and we also, some moms will come in and say, well, my friend didn't have XYZ experience. Why am I having this? Well, your friend didn't have type 2 diabetes. Your friend did not have hypertension. Or your friend probably that was her third or fourth baby. This is your first. So it's okay. Give yourself some grace. Give yourself that permission to be okay with this.
Yeah. What do you wish expecting parents knew that maybe typically isn't known?
What do you mean?
Well, people get misinformation from different places and come in with preconceptions, maybe don't have access to certain information. What do you wish more people knew?
Pick one or two resources. At least if they're going to pick a provider, make sure that provider you trust. If you don't trust your providers, you're going to go somewhere else. So pick a provider you trust, use them as a resource, and then pick another resource. Don't go to multiple resources because it's going to tell you different things. Because like I said earlier, everybody's different. Providers do a lot of things differently. All of my midwife partners, we all do things differently. Even though we come up with the same, agenda, or, we all hold the same philosophy, but how we get there, we all have our different, recipes on how we get there, right?
Yeah.
So picking one or two resources, go there and use them. Because otherwise, if you're going to use multiple providers as a resource, you're going to get a gazillion different types of answers, and it's just going to confuse you.
Mm-hmm.
I think it creates anxiety too,
Correct.
right?
Yeah.
Because it's just like, then what's the truth? Where can I put my 2 feet to the floor? When it's all of these conflicting thoughts, beliefs, ideas of what is. Yeah.
Yeah. The science is the same, but on how we get there is going to be different.
Yeah.
Yeah.
Well, what do you want our listeners to take away from this? Like, what's one thing, if they could just grab onto that in their journey of learning about this, what would you want them to take away?
Believe in yourself. Believe your gut. It's not always science.
Yeah.
A lot of times it's what your gut is telling you. And trust the provider that you're choosing, and then trust yourself.
Well, thanks so much for joining us. We're excited to have been able to talk with you today, and we look forward to just continuing these conversations.
Now, this is a great thing that you guys are doing.
Yeah.
So thank you for having me.
Yeah.
Thank you. Pleasure to be with you.
Yeah.
Please press the subscribe button, as well as rating and providing a review of our podcast. This helps others to connect with what you have been hearing. If you have any questions, please contact us at themindofatherapist@gmail.com. These questions will be kept anonymous. I want to thank Eric Price for the wonderful music you hear in this podcast. Additionally, this podcast was created to provide accurate and authoritative information on the subject matter. Although we are interviewing licensed therapists, they are not your therapist. This podcast is not intended to serve as direct medical advice and should not be used as a substitute for direct professional help. It is given with the understanding that neither the host, publisher, guest, or PCS are rendering legal, medical, or clinical professional information. If you need a professional, we encourage you to find one. Visit Psychology Today to find a licensed clinician near you.